What makes SwingMed so special? It's the combination of stretching and mobilization along the spinal column that makes the novel dynamic extension device SwingMed so very special. Treatment with SwingMed, the spine is gently extended. The small spinal joints are mobilized, the muscles and ligaments are gently stretched, and pressure around the intervertebral discs is reduced. Dr. Erich Mohr, Professor of Physical Medicine and Rehabilitation Rheumatology at Innsbruck Medical University, knows how dynamic extension therapy works. SwingMed is particularly suitable for patients with degenerative changes of the spine, especially of the intervertebral discs and the small vertebral joints. In addition, also patients with back muscle tension can profit from this treatment. Till now, nearly 50,000 single treatments have been carried out in Europe. The treatment was well tolerated and there were no severe adverse effects. In fact, a majority of patients reported highly positive treatment effects. Studies have shown that the success rate is above 80% with the effect lasting for 6 months. Dynamic extension therapy is contraindicated in the following cases: spinal fusion surgery, intervertebral disc prostheses, and severe ligament injuries in the lower extremities. The effectiveness of the SwingMed results from several components of the treatment. On the one hand, muscles and ligaments are stretched. On the other, the spine is mobilized and at the same time pressure around the disc is reduced. To give just one example of patient experience, the patient had severe long-standing low back pain with increasing intensity of pain over time. She was hardly able to move anymore. Investigation with MRI showed lumbar disc herniation as the cause of her severe pain. After several unsuccessful treatments and infiltrations, an operation was considered. Shortly before surgery, the patient heard about SwingMed. Already after the first 2 treatments, the patient showed substantial improvement. Initially, she had to get used to the treatment. In the meantime, she finds gravity from the other end quite pleasant. And above all, she's pain-free.
Von der anderen Seite sozusagen.
This is Arthur Fry today. After only 9 treatments with MBST, nuclear magnetic resonance therapy, his knee has recovered and he's completely fit again, no matter what he does. And this is Arthur Fry before the therapy. He used to be in absolute agony when climbing stairs, whether he got out of the car or stood up from a chair. Every movement caused pain to his knee.
After the therapy, so the pain relief showed very quickly. I felt the improvement. I felt that this cartilage was working as it should, and today it's the same as it used to be, as if nothing had happened.
This is a result of the MBST nuclear magnetic resonance therapy. It has already successfully treated 180,000 people worldwide, improving their quality of life. Pain-free and without any side effects. MBST nuclear magnetic resonance therapy is based on a natural principle. It can stop the degeneration of cartilage in the joint and can build up new cartilage. As is the case with healthy joints, so that patients can lead an active life again.
The MBST is a stimulation of tissue which definitely causes a change. Without exception, everybody was satisfied. Everyone we called and spoke to, because we hadn't heard of them since, told us they were happy not having to suffer from pain anymore, and attributed it to this method.
The technology is approved by MRI magnetic resonance imaging. MRI scans are used to create images of joints. The MBST nuclear magnetic resonance therapy adds frequencies. These can influence specific types of cells and stimulate their regeneration. A further advantage of MBST nuclear magnetic resonance therapy. It can also treat patients suffering from osteoporosis or with injuries from sports or from an accident. The machine is simply tuned to the specific frequency of bone cells, of muscles, of cartilage cells, or to the cells of tendons and ligaments. Dr. Alexander Block is suffering from a vascular necrosis of the hip, which means his bone tissue in his hip is dying. And here, MBST nuclear magnetic resonance therapy can also improve the symptoms.
We had 9 sessions. After the therapy, it had improved tremendously. The symptoms of restricted movement have disappeared almost completely. Meanwhile, I'm able to climb stairs again without pain. I can turn around in bed again without pain. And especially when I walk, I don't have this typical relieving posture anymore, which you suddenly have. So, almost completely normal again.
MBST is pain-free and without any side effects. Many patients benefit from sustained pain relief and improved mobility. The therapy costs are taken over more often, and most patients would do the same again and at any time. The bottom line, it was worth every cent.
The life quality I've regained by this is, I would guess, about 20 years of my life. My mom has also been here for treatment of her finger joint necrosis, also with MBST, and she's also without pain. So that I would use this myself. In case I had these complaints, which may appear now and then, I would use this myself.